Hello everyone, welcome to Easy Pharmaco. Learning pharmacology made easy, one-stop center. Let's explore together. Today, we're going to talk about pharmacokinetics. Do you remember what does pharmacokinetic means? For recap, pharmacokinetics is essentially what happens to the drug once it's inside the body. This can be broken down into four components: absorption, distribution, metabolism, and excretion. You will often see this simply referred to as ADME, A-D-M-E. So, we go one by one. A, as for absorption. It is the process of the drug moving from the site of administration across the membranes. It can have a local effect such as when the dentist injects lidocaine into the tissues of the mouth, or it can have an effect on a remote site or target cells. For example, nitroglycerin paste is placed on the skin but exerts its effect on target cells on the blood vessels. D. For distribution. Distribution is the process of drugs being transported through the body. Distribution is affected by various factors. First, binding. Some drugs will bind to plasma proteins and therefore be unable to attach to their target cells. We can typically anticipate how much of a drug will be bound, but if the patient gets another drug that interferes with this binding, they then have increased levels of unbound medication in the system, which can lead to toxicity. The term bioavailability refers to the amount of drug that is available to have its intended effect. Next factors is barriers. There are three key organs that have anatomical barriers that prevent drugs from reaching body tissues. There are the brain, which is the blood-brain barrier, the testes, which is the blood-testicular barrier, and the placenta, which is the blood-placental barrier. These barrier tissues are not completely impenetrable. Lipid-soluble drugs are able to pass through them, and inflammation can also make the barriers more permeable. Other factors that can affect distribution are pH, body water and body fat composition, perfusion, and disease states. Next is M for metabolism. Metabolism refers to the chemical conversions of drug from one form to another. While some medications must undergo metabolism to be made more active, most of the time metabolism renders the drug inactive and therefore is an important component in clearing the drug from the body. A key player in the metabolism is the liver. Not only does the liver metabolize many medications, it is also responsible for something called the first pass effect. When you take medication by mouth, it is absorbed through the intestinal mucosa. It then enters hepatic circulation and is then directly to the liver for metabolism. In some cases, the first pass effect can reduce a medication's efficacy by up to 90% when compared to intravenous administration. This explains why intravenous doses are sometimes so much smaller than per oral doses. Last but not least is an E, which is excretion or elimination. Elimination is the process of physically removing the drug from the body. This typically occurs via the renal system, but drugs can also be eliminated via defecation, exhalation, and even through glandular activity. Since the key player in elimination is often the kidney, you will notice that many drugs are used cautiously in renal impairment, and doses will often be lower when patients don't have optimal kidney function. Key term related to elimination is the drug's half-life. This is the measurement of time that it takes the drug concentration in the plasma to be reduced by half. It essentially tells us how long the drug will exert its effects. So, drugs with a longer half-life will be given less frequently. And because metabolism and elimination are directly related to the drug's half-life, if liver and renal function is impaired, the half-life of drugs can be increased. As you learn new medications, try to learn them in the context of how and why they are used. When you know why a medication is beneficial for a particular disease condition, you don't have to rely so heavily on memorizing since you have a basic understanding of why and how it works. It's also important to lay a solid foundation by understanding some important underlying pharmacology concepts, one of which is the concept of pharmacokinetics. I hope you can understand this topic well. Till we meet again in another session. Thank you for listening. Bye bye.